Now to what may be another hopeful sign on the testing front. We have an inside look this morning at a military-funded lab that they say will be a game changer, able to do tens of thousands of tests per day. ABC's Devin Dwyer has more.
Some scientists are calling it a COVID testing breakthrough, a supervised but self-administered test for coronavirus from a sample of your saliva. Experts say if done properly, it could be as effective and much easier to perform than those intrusive nasal swabs by medical workers covered in PPE.
It's low risk. It's a different set of supplies that are needed.
ABC News got an inside look at one new oral fluid coronavirus testing lab in the nation's capital, a facility funded by the U.S. Air Force to test thousands of military personnel. Biotech startup Curative flying in the equipment from California, setting up the lab to test saliva samples in 24 hours or less.
That lab will be scaling to 50,000 tests per day of capacity over the next few weeks.
The Defense Department calling the $13 million project a risk reduction alternative to nasal swab testing and potentially game-changing.
We have the ability to expand our testing capabilities to wider military populations, prioritizing the highest risk to forces.
If it's successful, experts say widespread oral fluid testing could greatly improve surveillance of the coronavirus across the U.S.
We really need enough testing, tracing, and supported isolation to control the disease so that we don't see resurgences.
So take the swab out of the packet.
We took the test to try for ourselves.
Now cough into your elbow deeply 3 times.
Coughing into the arm to release fluid from the lungs into the mouth, then swabbing the mouth for 20 seconds. The test must be supervised by a clinician, but with proper social distance does not require extensive PPE. While authorized by the FDA, the accuracy of self-collected saliva tests in general is still under review. In one study from UCLA, oral fluid and nasal swab specimens performed similarly when detecting COVID-19. But a third of infected individuals who swabbed their mouths without clinical supervision registered false negatives, but still showing enormous promise.
This may be a long-term model for how we could scale up a return to work effort across the country.
For Good Morning America, I'm Devin Dwyer in Washington.
And now let's bring in our chief medical correspondent, Dr. Jennifer Ashton. Thanks so much for being with us. The antibody testing of healthcare workers in New York City, how helpful will this be if, as the World Health Organization says, we really don't know yet whether having had this virus leads to any kind of immunity?
Well, Eva, I think you have to remember, as the saying goes, the devil is in the details. Also, the devil will be in the data and how accurate those results are. Basic premise in medicine is that when you've been exposed to a virus, you will develop some immunity to it. But how long that lasts and how strong that protection could be is still to be determined. And remember, antibody testing is to determine past infection, ideally, or susceptibility. So it could be potentially very important.
Now, we saw in Devin's piece the saliva testing. The military-funded lab is talking about eventually doing 50,000 tests per day. How significant is this?
Well, again, now we're switching to how do we diagnose active infection, and that absolutely is critical. So whether it's by a saliva test or a nasal swab or a finger stick, the key is accuracy. And as we heard, any test can have false positives or potentially false negatives, and turnaround time. So 24 hours, great, but ideally this will move to a point where someone can do it at home, like a home pregnancy test, so then you can act on those results, whether they be isolate yourself if it's positive or negative, and potentially then you can return to work. So we need to scale up, and they need to be accurate. And 50,000 a day is great, but there are some epidemiologists and public health experts that say we'll need to be able to do millions of tests a day.
Okay, now talking about like symptoms and people being sick, the CDC adding to the list of coronavirus symptoms. A lot of these are symptoms that we've already heard about.
We have, Eva, and just a little bit of mini med school here. A symptom is something that you feel. A sign of a disease is something that can be seen visually. The old 3 symptoms of COVID-19, fever, cough, shortness of breath. Now the CDC has added 6 more things like headache, body aches, chills, shaking chills, a sudden loss of smell or taste. But again, those have been reported in the medical literature for some time now. It's unclear why just now the CDC is changing and adding to that list of symptoms. But clinicians know that there are typical symptoms of this mysterious virus, and then there are atypical symptoms, and that list seems to be growing literally by the day.
Yeah, there's still a lot we don't know. Dr. Jen Ashton, thank you so much for being with us this morning.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.